think of social emotional well-being, I think about health. I'm over at the medical school, Harvard Medical School, and I work at Brigham and Women's Hospital, and so I think a lot about health and how, as parents, you do anything if your child got hurt. If your child fell down, knocked their head, bumped their knee, which is my 6-year-old every single day, you'll do anything to get them medical attention. But what about emotional health? What do we do to address that? How do we know if somebody is emotionally healthy? And that is largely an invisible, it's invisible. Emotions are invisible, and oftentimes, in particular for Asians, we hide our emotions. We hide our emotions behind our smiles. We hide our emotions behind a blank face. We don't say how we feel. And so that makes it all the more challenging for students to be able to share about what's going on in their lives. As Michele mentioned, we want to create spaces for being able to talk about vulnerable things. And I know for many, many families, not just Asian families, that talking about hard, difficult, vulnerable issues is virtually impossible. And we see that in our research, that students will say, I would never tell my parents. I don't want to burden them with whatever I'm feeling. And they might say things like, my parents are perfect. They're so successful. They're so good at what they do. They wouldn't understand what I'm going through. And in fact, many parents don't understand that. Many parents have sacrificed and have gone through traumas and have essentially said, I've faced difficult things, but I don't want to talk about it, and look how well I've done. And many students are intimidated by that and do not feel at all able to share what it is going on in their lives, even as parents are saying, we want to know. We desperately want to know how you're feeling, and are you feeling vulnerable? Are you thinking about hurting yourself? Are you depressed? Like, those are all things that we all wish we could find out, but we have to create spaces for it, and that often occurs with ourselves and examining our families and how we talk about our emotions. And so one example I give is, I have a 6-year-old, and he will say things like, oh, I don't want to tell you. I'm so embarrassed, I don't want to tell you. And it might be something that happened on the playground. And my first reaction is to say, you have to tell me now. And what does that do? He shuts down, the doors are closed, I can't get back in. And I've had to think deeply about, how do I get access to what he's going through? And we gotta do this now when he's 6. And so we've been playing around, at least I have, I'm trying to get my husband to do this, to share about our own embarrassing moments. And so I'll share my embarrassing moment, and my son will laugh, and he'll talk about my embarrassing moment. We'll do that for a while, and we kind of go around sharing our embarrassing stories. Now, this is not a typical thing we do, but maybe it needs to be a typical thing that we do to help facilitate and create this atmosphere of sharing. Once I did that, my son was like, okay, I'll tell you what happened. And it gave me a little bit, it opened the door for me. And so, in my research, I really try to find helpful, practical strategies for parents to try and have conversations with their children. I often find that parents say, it's awkward, I don't know what to say, I don't have the words for it, we use a different language, we don't talk about emotions in Chinese. And so I encourage you to think more about, what could it look like in your families to be able to start sharing about things that you might not normally talk about.
Impact of perceived discrimination. So you feel discriminated, but it's you are perceiving, right? So you can measure the perceived discrimination and impact on how that impact is different from Asian American women as well as men. So what we have found was that the impact of discrimination was greater for Asian American women, but it's greater in terms of the emotional impact as well as the physical. So it affects their suicidality, it affects their depression, and it affects their physical ailment, like headache, the backache, all those kind of things. It was impacting. Another study, it was a David Chet, recently published like a couple of years ago. It also supports that impact of discrimination on Asian American health is really detrimental.